Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Extension doctrine. In extension doctrine, during the course of procedure for which doctor has taken the specific consent and doctor discovered a new finding which was not anticipated or guessed prior to the operation, and this finding is dangerous, and so in good faith doctor can extend the consent and do the procedure which is legally valid. So, for example, the doctor has taken consent for laparoscopy through for appendicectomy. But later, during appendicectomy, he has found that there is a bowel leak. There is a bowel perforation, and the bowel perforation is leaking. Now he cannot continue the procedure on laparoscopy and he has to shift to the open procedure. During this condition, the patient will shift to the open procedure and um, taking that the prior consent is extending the prior consent, and this is legally valid.
thank you and thank you for watching.